Choosing a private ADHD provider is always a difficult choice, and sometimes the pricing structures can be very confusing. At Harley Street Mental Health, we aim to make the pricing structure as clear as possible, so you are aware of all of the potential costs before you even book your assessment. For our most up-to-date pricing, simply log into our website on www.hsmh.co.uk and then select the pricing tab. Here, you'll be able to see the most up-to-date pricing for our adult ADHD assessments, childhood ADHD assessments, transfer of care appointments, medication titration appointments, QB tests, repeat prescriptions, and shared care agreements. But what do these all mean? The adult ADHD assessment currently costs £715 if you opt to have this via video call, or £1,200 if you opt to have this in person at our prestigious clinic on 10 Harley Street. All of our assessments are conducted to a high standard in line with NICE guidance by doctors that specialise in psychiatry. The cost of the assessment includes a full comprehensive report that explains whether or not you have ADHD, along with a full treatment plan. Included in the cost of your assessment is the issuing of your first prescription should you wish to trial medication. But what are the further costs associated with your ADHD treatment? All prescriptions that are issued through Harley Street Mental Health are private prescriptions. This means that unlike NHS prescriptions, you will have to pay the pharmacy the full cost of the medication. The cost of medication will vary depending on what is prescribed and which pharmacy you choose to dispense your prescription. To help keep costs down, we allow our patients to choose any pharmacy to dispense their medication. The monthly cost of medication can vary from £45 all the way up to £150 plus for a month's supply. Medication titration appointments cost £150. When starting ADHD medication, it is expected that you will have titration appointments every month. These appointments help find the right medication and dosage that effectively reduces your symptoms whilst causing minimum side effects. The reason we need these monthly appointments is because there's no one-size-fits-all approach to ADHD treatment. Some people respond wonderfully to the first dose of their medication, while others may not feel any effect or experience unwanted side effects. Unfortunately, we can't predict how many of these titration appointments will be necessary. It varies from person to person. Some people may find the right medication and dose after just 1 or 2 appointments, while others may need more than 5 until the best solution is found. Included in each titration appointment will be the issuing of your next prescription slip to the pharmacy of your choice. During these appointments, we may also recommend alternative strategies such as therapy-based approaches. Once you are stable on medication, you will only need appointments either on an annual basis or if you wish to change medication further. This means that instead of booking an appointment, you can book a repeat prescription through the booking portal. This costs £48. It typically takes us 3 working days to process a prescription, and we can send them to any pharmacy of your choice. A shared care agreement costs £125. We can start these when you have found the correct type and dose of medication and are considered stable. We will prepare a proposal where we ask your GP to take over the regular prescribing of your medication on the NHS with the agreement that you would remain under our care for any annual reviews, changes in medication, or other advice that may be required. Some GPs have blanket policies where they will not enter into shared care agreements, so we recommend having a conversation with them early on. For all other questions, please email us at contact@hsmh.co.uk.